I see patients each and every day who have illnesses that I cannot treat medically or surgically. I can offer them pain medicines or nausea medicines, but I have nothing to cure them from their illness. Thankfully, medicine isn't all I can offer. I am Erin Meyer. I'm a family practice doctor here at Kujip Nazarene Hospital. When I first came to Papua New Guinea as a post-resident, everything was new to me. I didn't know how to treat malaria, I didn't know how to treat typhoid, I didn't know what pig bell was. After spending 2 years here, asking lots of questions, gaining lots of experience, I felt comfortable taking care of anyone who walked through the doors, the emergency room in our clinic without needing help.
It's a great privilege to mentor and be a part of discipling someone in missionary medicine. The eagerness of Dr. Erin to learn with us and to serve with us, and her willingness to do whatever is needed day after day, has been an invigorating thing for us.
I came to the mission field to be a missionary, and this is one thing I love about missionary medicine. I'm not just in a clinic, just seeing clinic patients all the time. I get to do procedures, I get to do ultrasounds, I get to put casts on, I get to give chemotherapy, I get to do a little bit of everything.
Every day people are coming to know Jesus. And Samaritan's Purse and World Medical Mission have been a real part of that as their doctors come and partner with us.
Brenda is almost 14 now. I met her when she was 12. Her mom brought her in for some problems with her back. In talking with some other doctors here, we checked a blood test and found out that she had congenital hypothyroidism. When we started her on medicines shortly thereafter, Mom came back glowing because she had spoken her first words and said, "Mama." Every time Brenda comes in to see me, it just brings a joy to my heart. Days here are tough and hard, but seeing Brenda smile, seeing God's love through Brenda is something that keeps me going. This is why I do what I do. The post-residency program of World Medical Mission was what I needed coming out of residency. I wasn't sure that God wanted me to be a long-term medical missionary. And so having a 2-year commitment allowed me to know for sure that God wanted me to be a medical missionary. I love the opportunity that I have to do a little bit of everything in medicine and to serve God and share His love with the people in doing that.
Bubba, God, me asking you step one time, Frankie. Me thank you, true, you've been helping them.
By praying with patients, by sharing the hope of Christ with them, it allows me to ask God to intervene and to help and to provide what I can't. It also gives comfort to the patients, knowing that it's not just this doctor on the other side of them who's helping them, but that God is involved. I do what I do because this is what God's called me to. I deal with people dying. I see the joy that people have. I see the laughter that they bring at times and the tears that I share with them at times. There's times when I go home and cry because I can't deal with all the death and disease that I've seen. But the opportunity to share God's love and God's hope with these people, with these children, to love them as I care for them, is what keeps me going and is why I'm here.